Assalamualaikum warahmatullahi wabarakatuh. My name is Saffiah Binti Azahar. My student ID is 2019234724. Today I will present to you about introduction.
So, what is anemia? Anemia is one of the most underdiagnosed conditions, and if left untreated can have many serious implications such as cardiovascular disease and compromised immune function. Anemia also defined as a decreased amount of red blood cells or the amount of hemoglobin in the blood. This happens because the blood has abnormally low oxygen carrying capacity. So, the blood oxygen levels cannot support normal metabolism. There are 5 types of anemia. First, iron deficiency anemia, aplastic anemia, hemorrhagic anemia, pernicious anemia, and sickle cell anemia. These all types of anemia happen because of the several reasons such as blood loss, destruction of red blood cell, and decrease in red blood cell formation. There are many symptoms of anemia such as pale skin, headaches, fatigue, dizziness, and difficulty in breathing.
Hi and Assalamualaikum. My name is Fatin, Nabilah, Binti, Mohamad, Lateh. In my part, I will explain about the problem statement, objective, and methodology. Problem statement. The purpose of the survey was to investigate how many university students suffer from anemia. Other than that, to improve the students' understanding as well as knowledge about the anemia, such as how to prevent the anemia. Anemia is a disorder in which your body's tissue don't get enough oxygen because you don't have enough healthy red blood cells. Anemia, commonly known as low hemoglobin, can leave you feeling exhausted and weak. Anemia comes in a variety of types, each with its specific reason. Anemia can be short-term or long-term, and it can be mild or severe. The first objective for this project is to study how many university students suffer from anemia. Second, to investigate the reasons of the anemia can happen. Third, to determine the effective treatment to treat anemia. Lastly, to observe the knowledge of respondents in the age group of 17 to 30 years about anemia. Due to the COVID-19 pandemic, we were unable to conduct the interview through face-to-face interview. Therefore, survey was conducted through an online platform instead. We selected respondents in a group of university students aged from 17 to 30 years regardless of whether they were female or male. We chose both genders because both can get anemia, but female are twice as likely than male to have anemia. The online platform that we chose is Google Form, where the link for the Google Form was disseminated to university students via WhatsApp status and WhatsApp group. The Google Form link was distributed on 23 November until 24 November 2021. We chose to use Google Forms as a platform to collect feedback data from university students as it is one of the common platforms used by students to collect data. Therefore, it can make it easier for respondents to fill out the feedback and access the Google Form. In addition, we managed to collect a total of 64 respondents, which has exceeded the minimum target of 30 respondents. For questionnaires, there were 13 questions asked to the respondents, of which all questions were asked in multiple choice questions except questions number 1 and 9. Among the questions we asked the respondents in the Google Form are: in addition, each of the group members had the personal conversation with the respondent through the WhatsApp platform.
Assalamualaikum. My name is Mohamad Azharuddin Rashid, and today I'm going to explain about the result from our project. From the feedback we received, a total of 64 respondents provide feedback from our project entitled Anemia. Therefore, a total of 82.8% of 53 people are respondents aged between 70 to 20 years old. 12.5 or 8 people are respondents aged between 21 to 24 years old. and 4.7% or 3 respondents are between 25 to 30 years old. On the next feedback question, we found that 68.8% or 44 of the respondents are female, and the 31.3% or 20 of the respondents were male. In the next feedback question, we have information about the respondent knowledge about anemia. An example of the question we gave was whether they had ever heard of anemia. Therefore, a total of 90.6% or 58 people have heard of this anemia, while a total for 9.4% or 6 people have never heard of it. The next feedback question, we asked about whether their respondents understood the meaning of anemia. 82.8% or 53 of them state that anemia is an increase in iron in blood. 10.9% or 7 of them state that anemia is a lack of iron in the blood, and 6.3% of 4 people did not know about it. On the next feedback question, we have speculated that what caused anemia, and respondents can choose more than one cause. 2.8% or 53 people from the respondents state the cause of the anemia was decreased dietary iron intake, and 56.3% or 36 people state that it is due to increased blood loss during the menstrual cycle. 21.9% or 14 people said it was due to increased need to refill in adenosine, and 6.3% or 4 people said it was due to worm infestation. On the next feedback question, we have speculated that what organ that is affected by anemia. 75% or 48 people are respondents state that anemia affects the heart, and 25% or 19 people state that it affects the liver. On the next feedback question, we will ask about the symptoms that we experience anemia, and the respondents were given the opportunity to choose more than one option. 78.1% or 50 people state the symptom that pale skin color, and 71.9% or 46 people choose to have headache. 3.3% or 45 people choose symptom of fatigue. 53.1% or 34 people express the symptom of difficult breathing. 46.9% of 30 people choose the symptom of heart pumping fast. 6.6% or 70 people choose a lot of appetite, and 9.4% or 6 people choose emotional disorders. On the next feedback question, we inquire about whether the respondent ever heard anemia and the year they were found out about it. 90.6% or 58 of the respondents had never heard of anemia. 7.8% or 5 of them have anemia and know it early as 20 years old, and below of 1 or 1.6% have anemia and late of 20 years old. The feedback question, we speculate about what the effect of anemia, and they can choose more than one option. 55% of 48 people choose the effect of decreased working capacity. 43.8% or 28 people state the decreased growth and the development, while 23.4% or 15 people state the effect of anemia is decreased learning abilities. Feedback question, we have inquired about the seek advice and treatment with a doctor. 84.8% or 54 of the respondents had never sought a treatment and advice from the doctor, while 15.3% or 10 of them has ever heard sought of treatment. On the next feedback question, we speculate that how prevent anemia, and they can choose more than one answer. 68.8% or 44 of them choose increased dietary iron intake and consuming vitamin C rich from fruit. 7.2% or 43 of them choose to get enough vitamin B12 and folic acid in your diet. 69.1% of 22 people choose to avoid a post-meal tea and coffee, and 31.9% of 40 people choose personal hygiene. On the last feedback, we speculate that how did the treatment anemia. Total of 48.4% or 31 people are respondents state the transfusion of red blood cell, and 31.3% of 20 people state the consuming vitamin C tablet. 14.1% or 9 people state with IFA supplementation, and 6.3% of 4 people state with demorin.
Assalamualaikum warahmatullahi wabarakatuh. My name is Athirah binti Shaharum. My student ID is 2019299758, and today I would like to talk about the discussion about the anemia disease. What is anemia? Anemia is a hematologic condition characterized by a quantitative shortage or circulating red blood cells or hemoglobin, which is frequently accompanied by a reduction in the number of erythrocytes. Anemia occurs when low levels of the oxygen-carrying portion of red blood cells, and do you know, the chronic illness anemia is usually a mild to moderate condition. There were 90.6% or 58 out of 65 respondents who heard about the anemia disease, while 9.4% of 6 respondents did not know about the anemia disease. Anemia is a serious global public health problem that usually affects young children and pregnant women. Worldwide, 42% of children under the age of 5 and 40% of pregnant women are anemic, according to the World Health Organization. Following that, I will go through the 5 components of anemia diseases, which are symptoms, causes, doctor diagnosis, prevention, and treatment for anemia disease. The first one is the symptoms of anemia disease. The signs and the symptoms of anemia differ based on the origin and severity of the condition. You may not have any symptoms depending on the reason of your anemia. If signs and symptoms do appear, they may include fatigue, weakness, pale of yellowish skin, irregular heartbeats, shortness of breath, dizziness, chest pain, cold hands and feet, headache, and the last one is the decreased appetite. Next, the causes of anemia disease. Anemia can be caused by a disorder that is present at birth or a condition that develops later in life. Anemia is a condition in which your blood lacks enough red blood cells. They may occur if your body is really not producing enough red blood cells. When you bleed, you lose red blood cells faster than they can be replaced. Red blood cells are destroyed by your body. The causes of different forms of anemia differ. They include the following: iron deficiency anemia. A lack of iron in your body causes this type of anemia, which is the most frequent. Iron is required for the production of hemoglobin in bone marrow. Your body cannot make enough hemoglobin for red blood cells if you do not get enough iron. Next, vitamin deficiency anemia. To make enough healthy red blood cells, your body requires folate and vitamin B12. Reduced red blood cells production can be caused by a diet low in these and other essential nutrients. Even if they ingest enough B12, some people are unable to absorb it. This can result in anemia due to vitamin shortage. Next, aplastic anemia. When your body does not create enough red blood cells, you get this rare, resistant anemia, infections, some drugs, autoimmune diseases, and toxic chemical exposure, and all causes of aplastic anemia. Furthermore, I will discuss how anemia is diagnosed by doctors. Anemia will be diagnosed based on your medical and family histories, a physical exam, and test and procedure results. Because anemia does not always create symptoms, your doctor may discover you have it while evaluating you for another problem. The first one is medical and family history. If you have any of the common signs or symptoms of anemia, your doctor may inquire. He or she may also inquire about any diseases and infections that could cause anemia. The second one is in physical exams. The doctor will do a physical exam to find out how severe your anemia is and to check for possible causes. The third one is diagnosis, tests and procedures. You may have various blood tests and other tests or procedures to find out what type of anemia you have and how severe it is. Moreover, the prevention for anemia disease, which is many types of anemia, are incurable. However, iron deficiency and vitamin deficiency anemias can be avoided by eating a diet rich in vitamins and minerals. Eat plenty of iron-rich foods. Eat and rinse vitamin C-rich foods, avoiding drinking tea or coffee with your meals, as they can affect iron absorption. Get enough vitamin B12 and folic acid in your diet. The last one is the treatment for anemia diseases. Your doctor will determine if the anemia is due to a poor diet or a more serious health concern. You can then be treated for both the anemia and the main motivation. Treatment for iron deficient anemia includes iron supplements taken by mouth, foods high in iron and foods that help your body absorb iron like foods with vitamin C. Iron given through an intravenous for infusion. And the last one is transfusions of red blood cells.
Hi, Assalamualaikum. My name is Fazatul with Hamdan and my student ID is 2019241106. Today, I will summarize a conclusion about our topic anemia.
In conclusion, from the Google form which is feedback from the respondents about the topic anemia, it was shown that many of people already know or always heard about the anemia, but there are some of them still do not know what it is anemia actually. Anemia is one of the common diseases that always happen in our community, but some of the patients with anemia are very difficult to identify. This is because there are some of patients with anemia who have symptoms and some who have no symptoms. Even some of them do not know or realize that they themselves have an anemia. Just know they have anemia when the anemic disease gets worse without showing any early sign. In fact, there are various causes or factors that contribute to anemia. For example, iron or vitamins deficiency anemia, hemolytic anemia, and so on. However, it doesn't mean that anemia disease cannot do any of treatment. Instead, there are various treatments or initiatives that have been applied to anemia patients until now to treat them back to normal. Other than that, to avoid from getting anemia disease, we can prevent it by eat and drink vitamin C. Avoid drinking tea or coffee because it can affect for iron absorption. So, we should adopt a healthy lifestyle for a comfortable and perfect survival. Anemia is not give a bad effect to someone, but it still can be more worse or dangerous if not treated or cured. Instead, many anemia patients feel disturbed by the disease because the disease interferes with or limits their activities to be active. Finally, everyone needs to take anemia seriously. This is because anemia is not only a hereditary disease, but it can also be found although the individual does not have a hereditary disease of anemia. That's all from our group. Thank you.